Hello everyone, in this video we are going to discuss about the pleura. What is pleura? Pleura is the serous membrane lined by mesothelium. So it is the serous membrane which is lined by mesothelium. During the development, there are two pleural sacs present on both sides of the mediastinum. These pleural sacs are invaginated by both the lungs, and hence there are two layers of pleura. One is parietal layer and another is visceral layer. So we'll first discuss about the visceral or the pulmonary pleura. So what is pulmonary or visceral pleura? It covers the surfaces of lungs. It covers all the surface and the fissures of lungs except the hilum. So at hilum it continues with parietal layer. So visceral layer is also known as pulmonary pleura because it covers all the surfaces and fissures of the lungs except at hilum where it continues with the parietal layer. It is derived from splanchno-pleuric mesoderm. So this is about visceral or pulmonary pleura. Then we'll discuss about the parietal pleura. Parietal pleura is derived from the parietal layer of lateral mesoderm. It is subdivided into four parts, which are the costal pleura, cervical pleura, mediastinal pleura, and the diaphragmatic pleura. So first is costal pleura. As the name suggests, it lines the thoracic wall. It lines the lungs beyond the thoracic wall. So here in this diagram, costal layer is denoted with green color. This is the costal pleura. It is loosely attached by areolar connective tissue known as endothoracic fascia. So this is about costal pleura. Then we'll discuss about cervical pleura. Cervical pleura, it lines the lungs at apex. It lines apex of lungs. It is reinforced. It is reinforced with a membrane called as Simpson's fascia. Simpson's fascia or suprapleuric suprapleuric membrane. So in this figure, see, this is the C7 vertebra and this is the inner border of first rib. Inner border of first rib. And this is the apex of the lungs. So the cervical pleura lies here, lining the apex, and it is reinforced with this membrane called as Simpson's fascia. So Simpson's fascia, it extends from Simpson's fascia or suprapleural membrane. It extends from C7 to the inner border of first rib. It is nothing but the degenerated scalenus medius muscle. Degenerated scalenus medius muscle, and it is related with the subclavian artery and vein. These are related with this Simpson's fascia. So this is the Simpson's fascia. This is subclavian artery and subclavian vein. Now we'll see about the mediastinal pleura. Mediastinal pleura, as it suggests, it lines the lungs. It lines the part of the lungs corresponding to the mediastinum, corresponding to mediastinum. And it is reflected over the root of the lung. And then comes lastly the diaphragmatic pleura. It lines the lungs along the diaphragm. In this figure, see, the pleura lining lungs corresponding to the mediastinum is mediastinal pleura. This shown in the orange color is cervical pleura. And here is the diaphragmatic. So these are the different parts of the parietal pleura. Here we come to the another topic, that is pulmonary ligament. Pulmonary ligament is nothing but the extension of pleura. See, this is the pleura which is lining the root of the lungs. This pleura, it extends downwards beyond the root of the lung, and this is known as pulmonary ligament. It is nothing but the extension of the mediastinal pleura beyond the root of the lung. So this is the root of lung which contain the pulmonary artery. These two are the pulmonary veins, and this is the bronchus. So together this forms root of the lung. The pleura, which covers the root of the lung, is extended downward, which is known as pulmonary ligament.